Hey YouTube, this is Dr. Ray and Dr. Pace. We are back again. In this discussion, we're going to talk about 3 reasons why it is harder for ethnic minorities to enter nursing. So we're going to start off with Dr. Pace talking about some of the reasons why racism is one of the barriers to ethnic minorities in entering the field of nursing.
So we're going to start with racism. And racism, as you all know, is part of how everything has been in society from the beginning of, I won't say beginning of time, but from very early years. And nothing has changed when it comes to nursing and specifically. So when it comes to the nursing profession, as you know, it's dominated by women and mostly Caucasian women. Well, if you knew the history of nursing in itself, you'll know about Florence Nightingale. Florence Nightingale is considered to be the mother of modern day nursing. What they fail to tell you in the history books about her is that she was actually a racist and she also was a sexist. She did not want minorities, specifically Black people, in nursing, and she did not want men in nursing. Hence why it looks the way it looks now. If you think about who your faculty members are, they are Caucasian white women typically. If you think about who you see on the floor as nurses, Caucasian white women primarily. If you think about who you see in management, primarily Caucasian white women, primarily. Now, I know some of you may live in areas or pockets of the United States or wherever where you see a influx of minority people. So if you live in Detroit, Jacksonville, Philly, Chicago, different places like that, you're going to see different pockets of, where it is the majority is minority. However, we're talking about the world as a whole, not just those pockets. So you may see certain things where like, oh, everybody I went to school with was Black. Or if you went to a HBCU, granted, that's going to be different. We're talking about the world as a whole, not just certain pockets of the population. So racism has always been a part of making sure that we did not get the same education as they did. Again, it was started with your girl Florence and her antics in terms of not wanting minorities in nursing. She also, if you knew your history, your true history when it comes to nursing, she wanted, and not to get into nursing pioneers per se, but it kind of ties into the whole thing if you think about it. If you think about how racist the nurses, some of the nurses were, and when it ties into her and Mary Seacole, Mary Seacole on her, Mary Seacole was a Black nurse, a Jamaican actually, and she, actually is the one who actually did infectious diseases and sanitation and things like that. But your girl Florence took that from her, got all the accolades, and that's who she's noted for doing those things when it was actually Mary Seacole who did that. So for the history, as long as it is, in every aspect, it's been someone who has been Caucasian, typically, who has taken something that a Black inventor done or come up with, and then taken it from them because of whatever ranks that they have that they could do that. That's the same thing that happens in nursing. So when you think about another nurse named Margaret Sanger, she was one who was the mother of or the founder of Planned Parenthood. Well, where do you think she placed those Planned Parenthoods? She placed them, again, her notion was good in terms of she wanted to stop back alley abortions. But stopping back alley abortions, she used that as a caveat in order to say, okay, I'm going to strategically place Planned Parenthood in the hoods, the rough areas of part of town, so that we can stop having brown babies, because we were having babies at rates comparatively to the counterparts. So again, if you already have nurses in nursing who are racist, why would you not think that they would be part of the selection process even today? And being that we do the Nightingale Pledge and things like that, that they would not have a hand in selecting who is and who is not part of nursing. And then keep in mind, I always say that diversity, equity, and inclusion is a trend. It is a common trend now that goes on that says, okay, you know what? We're going to have our 1, 2, or 3 token minority students to say that we are part of this trend. And yes, we're not racist because we have these 3 students out of 80, but okay, 3 students in this program and so forth. So that's a few ways that racism plays a part, that we just are not selected because of simply who we are. The next thing that we are, another reason, number 2, is our support systems. Our support systems, unfortunately, are in places in which we don't even have the luxury of having to stay at home. We typically, our parents, some of us, not all of us, nothing I say is totality, so don't think that every Black person does this or every white person does this. That's not the case. I'm just speaking of what the data suggests. But in general, we have the tendency as Black people to put our children out earlier, At age 18, you grown, you got to go. Our counterparts don't do that. They support them until they go get married. Sometimes they're 25, 26 years old, then give them money to put it down on a house and everything. So they don't have the barriers, which I won't get into too deeply here, that we have in terms of, okay, you know what? We have to get out on our own at 18 sometimes, or 19 or 20. We have to live the adult life with little income. Nursing school requires so much of us that we oftentimes have to work. They don't. Not always, but they don't typically. And so support, just the support of somebody, and a lot of times we have children sometimes. Some of us have children. And who's going to take care of the child when they get sick? Who's going to take their child when there's inclement weather and we got to pick them up from daycare? The daycare don't open at a certain time, so you're not going to be successful in clinicals if you don't have a support system. So support systems are very important to have, not only in terms of just the support of somebody rooting you along, saying you can do it, we're here for you, not just for somebody showing up at your pending and your graduation, but also someone to basically just be there. Mama, I need a stethoscope. Let's go get you one. Well, mama don't have the money for a stethoscope because she's taking care of your younger brother and sisters. You on your own, you grown, you go do it. Go get a loan, this, that, and the other. So we have all these barriers, such as lack of support from our families, friends, or you know what? A good one is our friends. Sometimes because of how we grew up, we have a certain kind of friend, and they used to us ripping and running with them. But then we decide we're gonna get serious with nursing school and we can't rip and run no more like we used to. And our friends don't understand that. So we lose our friends along the way. And then we have to make hard decisions. I'm okay, you know, I'm gonna hang out with you, but I hung out with you. Guess what? I failed my test. I'm failing tests. I'm failing things. So I hung out with you because we're our lives are now shifting. So, you know, support system can be multifaceted, whether it be your parents, it be your actual faculty, it be your friends, and so forth. We have one more reason we're going to talk about today as to why the reasons as to why we have barriers in getting to, or hard times getting into nursing school. The last one is
So we're going to talk about poor prior education. So I'm going to start out with a quote from Malcolm X. When you live in a poor neighborhood, you're living in an area where you have poor schools. So on a larger aspect, a lot of ethnic minorities come from poor neighborhoods. And per Malcolm X, when you have poor schools, you have poor teachers. When you have poor teachers, you get a poor education. So starting out the gate, a lot of our schools in minority areas just tend not to be good schools. That's pretty much throughout the United States. So when you look in the ghettos, basically, those schools are typically not your highly rated schools, are typically not where you're going to find a lot of your scholars. Not saying there's nowhere, I'm just saying the majority of the time. So a lot of us are coming from broken schools and school systems where we were, for lack of a better term, we were counted out. So it's not a strong encouragement for us to even pursue higher education, let alone more prestigious fields such as medical fields, particularly nursing. And if you start talking about advanced practice and getting more advanced degrees, that's definitely not something that's pushed strongly in the educational system that services mostly minorities. Also understand that most ethnic minorities have some sort of root or foundation in violence and trauma just from the neighborhoods we grew up in. So if you're coming from a neighborhood that's very violent, that's going to transfer over to the schools. You know, you're going to have fights and behavioral issues and things like that. So that's not an environment that's conducive to learning. But let's just say somehow you beat those odds and you do get to college. Welcome. So now you're here in college, but 9 times out of 10, you're not. Now, I'm not saying never. I'm saying 9 times out of 10, you're not at Yale or you're not at one of the better state schools. 9 times out of 10, you're somewhere that's not necessarily one of the top tier schools. And when you start those courses, again, if you're at a poor school, you're going to get a poor education. So even though you may start with your English and your sciences and things like that, a lot of times those schools don't have the rigor needed to allow you to prepare yourself to be successful in nursing school. So we see a lot of those students who are weak in their sciences, although they just took a year or so worth of science credits, because it just the where they went, it just wasn't a challenging or rigorous enough program that held them to the accountability level that is needed to successfully enter and complete nursing school and to be a competent nurse that's going to take care of patients. So because of that, and because so many of us come from those neighborhoods and typically are brought up in such school systems, it's kind of a snowball effect in terms of our education. So when you haven't been taught how to study, you haven't been taught how to be a good student, so to say, that within itself will make it very challenging for you to compete, particularly for some of the more rigorous, more the better nursing programs, I should say, because you're competing against people who went to good schools and who had those opportunities to lay a stronger foundation. That those opportunities you may not have even known existed, or you weren't prepped for them because again you went to a poor school. So you're competing against someone that's coming from a stronger academic background than you, although you may be just as smart and just as capable, but in that moment, you just weren't adequately prepared to compete with somebody that had those advantages. So I think that's another strong factor as well. And even in areas where you have pockets of ethnic minorities, and there's, quite a few of us in an area, typically the schools still tend to be poor, opposed to some of the other areas where we are not the majority. Again, not everywhere, but most places. So if you make it to the point where you're able to compete with someone who's had those academic advantages, congratulations. But you got your work cut out for you.
Okay, so that wraps up our three reasons, or three reasons of many. This is not all inclusive, but that was three reasons as to why minorities have a hard time getting into nursing school. And so thank you for watching this video. If you happen to love this content, please watch other videos that we have in our playlist. In addition to that, please go follow us on our other social media platforms. They are both listed in the banner in the bio. Banner in the icons in the banner, I'm sorry. In addition to that, if you happen to want to know what textbooks you need to use for, or what we consider to be, what are some good books I can use for NCLEX prep, for anatomy, physiology, med surg, and so forth, then please go to our Amazon storefront. The link is also in the banner, and it will take you to our storefront, and you can pick up whatever you see over there that you think, like, I need this. Where can I find what's the best option for this? What's the best book for this? We have vetted these things to say that these are what we recommend you get to help you in your nursing journey. So until the next time, thank you for joining us again on this YouTube video, and we will see you in the next one.
Bye.